In your health news this afternoon, Alzheimer's is a growing public health crisis across Arizona. And while the impact is already reaching thousands of people, new stats show the number of people it affects is only projected to increase. And now one Valley doctor is leading the fight against Alzheimer's, working to make a difference when it comes to early prevention. 12 News journalist Trisha Hendricks explains how.
Alzheimer's Association stats show 150,000 people 65 years of age and older are currently living with Alzheimer's across Arizona. But right now, Banner Alzheimer's Institute is involved in a national research study called AHEAD.
Changes associated with Alzheimer's disease can start 10 or even 20 years before the symptoms start.
Dr. Poen Sai is the associate director for the clinical trial program.
So now we're trying to see if we can get ahead of the disease symptom by starting the treatment before the patient has significant cognitive issues.
He says the treatment that was approved by the FDA can actually slow down the disease progress.
It is very exciting for us.
The AHEAD clinical trial is testing the effect of an IV treatment called lecanemab in people who have no cognitive symptoms of the disease, but whose tests indicate they're at risk of developing symptoms.
I spent my entire career in research and development.
Keith Corban from Scottsdale has been in the study for 3 years. Keith had 4 loved ones on both sides of his family affected by dementia or Alzheimer's disease.
I watched them go through a particularly tough time.
Due to memory loss, 2 of those 4 family members couldn't recognize Keith before they passed.
Were you thinking, I have to do this for my loved ones, for myself?
I knew there could be a benefit for me personally. In the worst case, it would benefit other people.
To date, Keith has had 60 infusions, and while he doesn't know if he's on the drug and it's working, or several changes he's made with his diet, exercise, and supplements, his overall health has improved.
My hope is that one day Alzheimer's disease will be a very manageable or even preventable.
It would not be the menacing threat that it is.
Trisha Hendricks, 12 News.
Trisha, thank you. By taking part in the study, Keith gets medical treatment he wouldn't otherwise receive. Every 6 months, he has a complete physical and neurological EKG, blood work, and an MRI on his brain. That program is set to wrap up in April of 2025, but they are still looking for more people to participate.